Hi Anita, thank you very much for joining me. Would you be able to give me some insight into what your role is and what your job involves and where you work?
So I work at Ladysmith Children's Hospital. I'm a nurse practitioner in the Queensland Lifespan Metabolic Medicine Service, and my nursing role is to be the lead nurse through the state for any individual who's diagnosed with an inborn error of metabolism that's inherited, and they're often disorders that are life-limiting.
Yeah. So you have to communicate with both children and adults. So how do your communication skills differ when talking to parents and when talking to children?
So my communication style is always honest, open and transparent, and I'm careful that I use eye contact as the primary form of communication so that I can pick up any non-verbal cues, and that also gives me some clues as to if they're understanding what I'm saying. But with children, for me it's about making eye contact, keeping eye contact. So if they're only toddlers, I'll be down on my knees or sitting on the floor and we'll be playing together. The communication is short, they're short sentences and usually directive, and allow them time to talk back to me as well.
Yeah.
With adults, it's also honest and it's not so directive. There's lots of two-way communications. It's all open-ended questions. And yeah, that's...
I think maintaining the same eye level is a really effective way of communicating, because I know when I was younger, I always found it quite intimidating going to a doctor or a health professional. So getting on the same eye level, I think, is a really good tool to use to gain the trust of younger children and obviously adults as well.
Absolutely.
What communication skills do you use when talking to colleagues?
So colleagues there's lots of different levels of colleagues, because we have nurses. So I'm a line manager for nursing staff within the department, and I learned very on that when you're line managing staff, that they can't be my friend, so I have to maintain a professional boundary so that you can establish the procedures and everybody understands the way in which we want to deliver our service.
Yeah.
And with colleagues, so other health professionals, if I'm in a multidisciplinary team meeting, for example, and we're discussing the case conference, then there will be social workers and dietitians and other doctors in the meeting, and it's really important to allow everybody in that meeting to have an opportunity to discuss their role but also their plan. And so listening is important, repeating or rephrasing what had been discussed in the meeting, so maybe sometimes even if it's taking notes, so that nobody's being confused or misunderstanding the message, and then developing the plan so that everybody had been able to contribute to the plan but also feels like they've been listened to and respected for their professional opinion.
Yeah. I know that for me, delivering someone bad news would be really tricky. So how do you go about conveying this news?
So majority of the time, the first time we meet a patient, whether that be an infant and family or adult, it's usually bad news, because we're providing them with a diagnosis that they didn't know they had. For the child, it impacts on the parent-child relationship, and because it's confronting the information, it's usually a fairly short first session, and if there's anything that's just discussed in that session, it's important for me to follow through. So if I say I'm going to call you tonight, or we'll see you next week, or I need to get you these consumables, that I follow through, that I maintain that level of trust, and that then builds rapport if the families know, or the individual knows, that what you say you will do.
Yeah, reliability and trust seem to be quite universal things for all interactions.
Certainly are.
So how do you cope with patient conflict, between you and the patient? What communication skills do you use to sort of resolve those differences?
So with conflict of any type, so if it's a staff member or a parent, or sometimes even an adult patient, it's important not to become emotionally involved, because we need to understand that the emotions that we're seeing or the behaviour we're seeing is often driven by fear or anxiety or